Hi everyone, this is a detailed video of mine about fever. Well, a fever is a temporary rise in body temperature. It's one part of an overall response from the body's immune system. A fever is usually caused by an infection. For most children and adults, a fever may be uncomfortable, but it usually is not a cause for concern. For infants, however, even a low fever may mean there is a serious infection. Fevers generally go away within a few days. A number of over-the-counter medication lower a fever, but you do not necessarily need to treat a fever if it is not causing discomfort. Earlier on this channel, I have already uploaded a short video about fever. I hope you have seen that, and today I am going to discuss this in detail. Well, first of all, let me tell you the symptoms. Body temperatures vary slightly from person to person and at different times of the day. The average temperature has traditionally been defined as 98.6 degrees Fahrenheit, that is 37 degrees centigrade. A temperature taken using a mouth thermometer, that is oral temperature, that is 100 degrees Fahrenheit or 37.8 degrees centigrade or higher, is generally considered to be a fever. Depending upon what's causing a fever, other fever signs and symptoms may include sweating, chills and shivering, headache, muscle aches, loss of appetite, irritability, dehydration, and generalized body weakness. Now I'll tell you about how to take a temperature. Well, you can choose from several types of thermometers, including oral, rectal, ear, that is tympanic, and forehead, that is temporal artery thermometers. Oral and rectal thermometers generally provide the most accurate measurement of core body temperature. Ear and forehead thermometer, although convenient, provide less accurate temperature measurements. In infants, a rectal temperature, if doable, is somewhat more accurate. When reporting a temperature to your healthcare provider, give both the reading and the type of thermometer used. Fevers by themselves may not be a cause for alarm or a reason to call a doctor, yet there are some circumstances when you should seek medical advice for your baby, your child, or yourself. For infants and toddlers, a fever is a particular cause for concern in infants and toddlers. Call your baby's healthcare provider if your child is younger than 3 months old and has a rectal temperature of 100.4 degrees Fahrenheit, that is 38 degrees centigrade or higher. If the child is between 3 and 6 months old and has a rectal temperature higher than 102 degrees Fahrenheit or 38.9 degrees centigrade, or has a lower temperature but seems unusually irritable, sluggish, or uncomfortable, then you need to call your healthcare provider also. Between 7 and 24 months old child and has a rectal temperature higher than 102 degrees Fahrenheit, that is 38.9 degrees centigrade, that lasts longer than 1 day but shows no other symptom. If your child also has other signs and symptoms such as a runny nose, cough, or diarrhea, you should also call your healthcare provider sooner. Now I'll talk about other children. Well, there is probably no cause for alarm if your child has a fever but is responsive. And this means your child makes eye contact with you and your response to your facial expression and to your voice. Your child may also be drinking fluids and playing. Call your child's healthcare provider if your child is listless, confused, or has poor eye contact with you, is irritable, vomits repeatedly, has a severe headache, sore throat, stomach ache, or other symptoms causing a lot of discomfort, has a fever after being left in a hot car. You should seek medical care immediately in this situation. If he has a fever that lasts longer than 3 days, has a seizure associated with the fever, then in this case you should call your emergency number. If the seizure lasts more than 5 minutes or your child doesn't recover quickly, ask your child healthcare provider for guidance in special circumstances such as a child with immune system problem or with a pre-existing illness. Now I'll talk about the adults. You should call your healthcare provider if your temperature is 103 degrees Fahrenheit or 39.4 degrees centigrade or higher. You should seek immediate medical attention if the signs and symptoms which I am going to tell you accompany the fever. These are severe headache, rash, unusual sensitivity to bright light, stiff neck and pain when you bend your head forward, mental confusion, strange behavior or altered speech, persistent vomiting, difficulty breathing or chest pain, abdominal pain, pain while urinating, convulsions or seizures. Now I'll tell you the causes. Typical body temperature is the balance of heat production and heat loss, an area in the brain called the hypothalamus, also known as your body's thermostat, monitors this balance. Even when you are healthy, your body temperature varies slightly throughout the day. It can be lower in the morning and higher in the late afternoon and evening. When your immune system responds to disease, the hypothalamus can set your body temperature higher. This prompts complex processes that produce more heat and restrict heat loss. The shivering you might experience is one way the body produces heat. When you wrap up in a blanket because you feel chilled, you are helping your body retain heat. Fever below 104 degrees Fahrenheit or 40 degrees centigrade associated with common viral infections such as the flu may help the immune system fight disease and are generally not harmful. Fever or elevated body temperature might be caused by a viral infection, a bacterial infection, heat exhaustion, certain inflammatory conditions such as rheumatoid arthritis, inflammation of the lining of your joints, that is synovium. Okay. Also, a cancerous, malignant tumor can cause fever. Some medications such as antibiotics and drugs used to treat high blood pressure or seizures are also responsible. Some immunizations such as the diphtheria, tetanus, and acellular pertussis, pneumococcal or COVID vaccine. Okay, now I will tell you about the complications. Children between the ages of 6 months and 5 years are at increased risk of seizure that occur during a fever, that is known as febrile seizure. About a third of the children who have one febrile seizure will have another one, most commonly within the next 12 months. A febrile seizure may involve loss of consciousness, shaking of limbs on both sides of the body, eyes rolling back or body stiffness. Although alarming for parents, the vast majority of febrile seizures cause no lasting effects. If a seizure occurs, lay your child on the side or stomach on the floor or ground. Remove any sharp objects that are near your child. Loosen tight clothing. Hold your child to prevent an injury. Do not place anything in your child's mouth or try to stop the seizure. Also call your local emergency number if a seizure lasts more than 5 minutes or your child does not appear to recover well after the seizure. Get emergency room or urgent care services if it is your child's first febrile seizure. If your child doesn't need emergency care, you should see your child healthcare provider as soon as possible for further evaluation. Okay. Well, I think this video is getting long, and I'll stop here, and in my next video of this continuation of the fever, I will tell you about the prevention, diagnosis and treatment of fever. Thanks for watching this video. See you in the next video. Bye for now.